Hi everyone, Dr. Hall here. We're going to add in the more superficial muscles of the posterior leg, as well as do some of the deeper structures in the popliteal fossa. So that's where we're going to start, is the popliteal fossa, this space in the back of the knee. And there's actually a muscle deep to both the popliteal artery and the tibial nerve here. So I'm going to reflect those so that I can add it in. And it's a little muscle called the Popliteus, which is useful because it's in this popliteal space. And so the function of this muscle, which attaches from the lateral condyle of the femur to the proximal tibia, is to, when you're standing and your knee is locked, this muscle gives the knee a little bit of a twist and unlocks it for you. So you can kind of try that, stand and lock your knee and then unlock it and feel that it has a little diagonal kind of movement, a little bit of a rotational movement to help untwist and unlock your knee. So that is the deepest structure in the popliteal fossa. So our popliteal artery is going to run over the surface of that, as well as our tibial nerve, right, which is a branch off of our sciatic nerve. We had the common fibular nerve circling around laterally. So now we're going to add the muscles that you think of as your calf muscles. So the first one is this really big, broad muscle. So you're going to make a big, broad piece of clay, and that's going to attach to both the superior tibia and fibula. Okay. And this muscle is the soleus. This is the soleus muscle, and it is going to attach via the calcaneal tendon, which is also called the Achilles tendon, to the calcaneus, or that heel bone. And so it is a plantar flexor of the foot and ankle, right? So we have the soleus muscle, and then our other major plantar flexor is going to be the gastrocnemius muscle, which has two heads. And so what's interesting about this muscle is not just that it has two heads, but that they also attach to the Achilles or calcaneal tendon. And then they actually cross the knee joint and insert onto the femur. So the soleus and the gastrocnemius muscles are different because the gastrocnemius muscles assist with flexion of the knee. The soleus muscle only plantar flexes the foot, but the gastroc does both. We have one final muscle here to add. It has this little teardrop shape and then a very, very long, skinny tendon. So I'm going to actually move this. This muscle is going to attach just superiorly along the femur laterally, just superior to the lateral head of the gastrocnemius, and its tendon is going to course inferiorly and adjacent to but not merge with the Achilles tendon. So I'm going to go ahead and put my gastrocnemius muscle back. So that muscle is called the plantaris muscle. So the plantaris muscle is interesting because it has a completely separate tendon from the Achilles tendon. So if you've ever known someone who has ruptured their Achilles tendon, they often can still have a little tiny bit of weak plantar flexion because of this plantaris muscle, and you might remember that the tibialis posterior also assists. So let's do a dissection to review. We have our sciatic nerve up here, our femoral artery becoming our popliteal artery. Our most superficial muscle in the posterior leg is the gastrocnemius muscle with its two heads coming down and inserting into the Achilles or calcaneal tendon. We have the plantaris muscle, this little tiny muscle with a long, skinny, separate tendon, runs in between the gastric and the soleus muscles. Soleus muscle attaches to the leg bones only, to the tibia and the fibula, so it does not assist with flexion of the knee. Going deeper still, now we're going to have our Tom, Dick, and Harry. So, let's not forget the Popliteus. I love that one, right? So this strong muscle, this big broad muscle, is our Flexor Hallucis longus for the big toe. We have our tibial nerve running along with our posterior tibial artery. fibular artery out here, and this is our flexor digitorum longus, which crosses over the tendon of the flexor hallucis longus to supply the 4 smaller digits in the foot to flex them. And then the deepest muscle beneath the posterior tibial artery and the tibial nerve, we're going to find the tibialis posterior muscle. So that's it for the structures in the posterior leg.